A stroke is a medical emergency. It happens when blood flow to the brain gets interrupted. This interruption deprives brain cells of oxygen and nutrients. Without these essentials, brain cells begin to die within minutes. There are two main types of stroke. The most common type is an ischemic stroke. It occurs when a blood clot blocks an artery supplying blood to the brain. The second type is a hemorrhagic stroke. This type happens when a blood vessel in the brain ruptures, causing bleeding. Strokes can happen to anyone, but some factors increase the risk. High blood pressure is a major risk factor. So is diabetes. Other factors include smoking, high cholesterol, and a family history of stroke. Understanding the urgency of stroke is crucial. The faster treatment begins, the better the chance of limiting brain damage and improving outcomes for the patient. Rapid recognition of stroke symptoms is vital. The FAST acronym is a widely used tool to help identify stroke. Facial drooping is one sign, arm weakness is another. Speech difficulties like slurring are also common. Time is of the essence, so noting the time of symptom onset is crucial. However, not all stroke symptoms are as obvious as those in the FAST acronym. Headache is a common symptom, often sudden and severe. Nausea and vomiting can also occur. Some individuals experience confusion or a sudden change in their mental state. A less common type of stroke, cerebellar stroke, presents with distinct symptoms. These include problems with balance and coordination, dizziness, and abnormal eye movements. Recognizing these lesser-known symptoms can be life-saving. Paramedics play a crucial role in pre-hospital stroke care. Their actions can significantly impact patient outcomes. Upon arrival at the scene, paramedics quickly assess the situation and the patient's condition. They use the FAST method and check for other symptoms to make a preliminary stroke assessment. Checking blood glucose levels is essential. Low blood sugar can mimic stroke symptoms, so ruling out hypoglycemia is important. Paramedics also obtain vital signs like blood pressure and heart rate. Simultaneously, they establish communication with the receiving hospital, alerting them to the suspected stroke. Rapid transport to a stroke center is the top priority. Paramedics work swiftly to prepare the patient for transport, ensuring they are stable and comfortable. They may initiate IV access and administer oxygen if necessary. Throughout the process, they provide reassurance and support to the patient and their family. The phrase "time is brain" perfectly encapsulates the urgency of stroke. Every minute that passes without treatment, millions of brain cells die. Rapid action is crucial for minimizing brain damage and maximizing the chances of recovery. Early treatment can significantly improve outcomes for stroke patients. It can mean the difference between regaining independence and living with long-term disabilities. Thrombolytic therapy, a clot-busting medication, can be administered in certain cases to dissolve clots and restore blood flow. Public awareness about stroke is paramount. Recognizing the symptoms and calling emergency services immediately is crucial. Paramedics, with their swift actions and expertise in pre-hospital care, play a vital role in the chain of survival for stroke patients. Their dedication and quick thinking help ensure that patients receive timely treatment and have the best possible chance of recovery.